Dr. Liza Klassen is a fertility-focused naturopathic doctor in Vancouver, British Columbia. She bridges the gap between medical and emotional aspects of fertility, recognizing that the journey to conception is not solely clinical, but also deeply personal. She's passionate about helping her patients achieve and maintain healthy pregnancies, whether natural or assisted, with additional training in endometriosis, PCOS, recurrent pregnancy loss, and autoimmune conditions. My conversation with Dr. Liza was so enlightening. We really dive right into what endometriosis can look like when we're really suspicious of it, when someone is struggling to conceive, and what you can do to support your body right off the bat before even waiting for a diagnosis, how you can really start to address the aspects of endometriosis that can cause disruptive symptoms like pain, but also impact your ability to get and stay pregnant. So she really gives so many insightful tips and really highlights the point of how important it is to support your nervous system through all of it. So I hope you enjoy this conversation as much as I did. Dr. Liza, thank you so much for being with me today.
Thank you for having me. I'm so excited for our conversation.
Me too. So before we jump into the topic at hand, I'd love to hear a little bit more about you and just how you got into specialize in fertility and especially with this like tilt on endometriosis.
Yeah, so I have endometriosis, so we'll start there. So
Hmm.
it's a bit of a personal passion project. I think we are so kind of drawn to the areas of medicine that impact us specifically, right? And so I've always had this interest in women's health and hormones and endocrinology. And I actually discovered that I had endometriosis during naturopathic college. And so it was very timely to kind of direct my area of focus in practice. So and the merging of kind of endo and fertility was it kind of happened by chance. I started out not wanting to do fertility and ended up finding my way into it and realizing that I get to treat all hormonal health concerns when I treat fertility. Endometriosis being a huge part of that, as we'll discuss, right? The prevalence of endometriosis in our fertility population is significantly higher than the rest. And so it was kind of endo first led into fertility and it kind of snowballed from there.
Amazing. Yeah. Well, I feel like that's, like you said, it is so often that we have our own personal experiences. And I feel so strongly that that really, especially for endometriosis, I think it's so important that your patients know that you understand what they're going through. I feel like that gives such an extra, like, nice piece to this journey where they can really feel alone anyway. And so just helping them feel really understood, I think that's so powerful and amazing that you can turn what you have going on into something so beautiful and positive. So it's amazing.
Thank you. Yeah, I think you're so right when it comes to that kind of feeling misunderstood or alone, especially in endometriosis and misunderstood by the healthcare system. And there's so much kind of medical gaslighting and medical trauma that ends up happening as women are trying to get a diagnosis. And so being able to create a safe space with like empathy and compassion is something that I really try to prioritize with my
Yeah.
with my endo patients. Yeah, and
Yeah.
fertility patients.
Yeah,
Yeah.
of course. It's essential. Amazing. Well, today we're talking about endometriosis and especially how it impacts fertility. And, I'd love to start with, I mean, basically, and you kind of described this well already, like endometriosis, it's a really hard diagnosis to get in the first place. And there is a lot of, gaslighting and misinformation around it. How does it, show up, especially in the fertility world? How can this impact someone's fertility journey?
Yeah, sure. So when we think about endometriosis, what we classically think about is that like menstrual pain, really severe period pain that maybe we don't get relief from pain meds with. And classically too, we see pain at other points in the cycle, right? Maybe around ovulation or just this kind of chronic pelvic pain that doesn't even follow a cyclical nature. We also see pain with like bowel movements, urination, sometimes intercourse, right? Those are really like classic symptoms. When it comes to fertility, even just having trouble conceiving is a clinical sign of endometriosis,
Mm.
right? So I always say that if you walk into my office with infertility, especially unexplained infertility, and you have any sort of pelvic pain, any sort of refractory menstrual pain, I'm going to treat you very seriously as if you have endometriosis and advocate for a diagnosis along the way, because that's how strong those clinical predictors are. I think it's also really interesting. There's a whole collection of symptoms that fall under endometriosis that sometimes either we don't know or we don't correlate with endo, and then we're confused about why we experience all of these other things. And those can be things like digestive concerns, bloating, constipation, diarrhea, mental health. Up to 90% of people have depression or anxiety with endometriosis, chronic pain, chronic fatigue, brain fog, etc. Right? So there's this whole host of symptoms that kind of fall under the endo umbrella that may or may not be present in your particular case.
Yeah. Yeah. And I think that's great to line those out, not to make everyone afraid that they have endometriosis, but to say, hey, those symptoms that you're having, they could be associated, even though they're not usually, commonly talked about with that.
Yeah.
And how prevalent is it in those who have infertility or who are struggling to conceive? How common is it?
Yeah, so about 50% of people with infertility have endometriosis. And when we look at unexplained infertility on its own as a diagnosis, about 40 to 50% of that screens positive for endometriosis on further investigation. So it's high. It's really
Mhm.
high, right? And individuals with endometriosis are about 2 to 4 times more likely to have infertility. So if you have a current diagnosis of endo, right, we also see it that direction. But yeah, we need to take it seriously. About almost 1 in 2 people with infertility are screening positive for endometriosis.
Yeah, that's huge. And
Yeah.
how does it to give, not to have to go into deep physiology here, but how does it impact fertility? I'm sure a lot of people listening are like, well, what is the connection? How is endometriosis really impacting our fertility?
Yeah, it's a great question and it's super multifactorial. I think the easiest way, and I always think about fertility in these kind of boxes anyways, but we kind of think like ovarian health and ovarian function and then uterine health and uterine function, right? And endometriosis impacts both, right? So we see that endometriosis can lower ovarian reserve, especially if you're somebody who has endometriomas or those endometrial cysts on the ovaries.
Mhm.
But we also know ovarian reserve can be diminished just with the presence of endometrial lesions otherwise, right? Because we see an inflammatory environment, we see increased oxidation, right, that can cause damage to that kind of ovarian and follicular environment. So ovarian reserve and potentially kind of egg quality change is something that we see. And then when it comes to that uterine environment, there's lots going on, right? So there can be some structural changes due to like adhesions and scar tissue that can form from endometriosis or endometriosis surgeries, right? That's part of it. We do see that kind of pro-inflammatory environment, pro-oxidative environment. We see immune change, and obviously immune function is such a big part of early pregnancy with implantation and ongoing pregnancy. And so it's really a combination of those factors that impact both our ability to ovulate with regularity, have fertilization occur, implantation, and then ongoing pregnancy as well.
Yeah, yeah, that makes sense. And I think the same way. And I think that's really helpful to kind of break those down into like, it's almost like the different steps of making a recipe, for example, like, how a baby can be made and
Yeah.
how those things, like how endometriosis can impact at the different levels of that. And with approaching endometriosis, then you kind of mentioned if someone's coming into your office and they're maybe having some suspicious symptoms, they're having a hard time getting pregnant, where do people start? What's the best approach to take with that?
Yeah. So what's really interesting is that from a naturopathic perspective, most of our treatments for endometriosis are also fertility friendly. Like they're one, it's a really nice kind of one and the same approach. And so really again, what we're thinking is when we think about all those pieces we just talked about with the inflammation and the oxidative stress and the immune dysregulation, right? That's kind of what we're targeting. And everybody presents differently. So part of it too is understanding which pillars of that kind of endo presentation are you presenting with, right? And we go there. But high level, right, we're looking at that kind of Mediterranean fertility style diet like we would with any patient who's trying to conceive, with kind of added focus on reducing red meat and high fat dairy products and things like that we know potentially worsen endometriosis. From a supplement perspective, right, our vitamin D adequacy and sufficiency is essential, our omega-3 fatty acids, NAC or N-acetylcysteine is one of those kind of gold standard supplements for endometriosis, right? We see it improve pain parameters as well as egg quality and even reduce size of endometriomas. And it's something we use a lot in fertility as well, right? For that egg quality and uterine quality. So that's a nice kind of crossover. And then those really potent antioxidants, vitamins, right? So vitamin C, E, zinc, selenium, a lot of those are found in our prenatal vitamins as well, but making sure that we're having sufficiency of all of those as well. The other really big piece that I always stress with endometriosis is that nervous system regulation and safety piece, which is so essential for conception, right? Our body needs to feel safe to conceive. But in endometriosis and chronic pain, our body is wired away from that sense of safety. And so we work a lot on establishing that and using tools like clinical counseling, EMDR, breath work, etc., to help the body get into that place of safety and kind of relaxed receptivity.
Amazing. I'm so glad you bring that up because I feel like we can get so stuck in the physical body of how are we treating this? How do we treat the inflammation and safety, the feeling of safety. It's maybe something we can't put our finger on, but it is so important in every aspect of how our immune system is functioning, like you mentioned, how our body, like how we're turning on and off inflammation, all of those physical things also. But then yeah, just feeling like our nervous system is wired in a place to conceive. And then for someone, you were mentioned a lot of the symptoms that could show up with endometriosis. Are there any things that any other warning signs that you would look out for, or any like less common signs that you see when it comes to endometriosis?
Yeah, good question. So again, I think it's more if we have the absence of that kind of severe menstrual pain, kind of pain with bowel movements, pain with urination, pain with intercourse, none of that is present, but you are struggling to conceive, right? And we have presence of some of those less common things like IBS-like symptoms or kind of chronic fatigue. Maybe we've got kind of super prevalent anxiety or depression, right? All of those things are still like light bulbs in my head that it's like this warrants further investigation, right? And we know that endometriosis presents differently with everybody, and staging of endometriosis doesn't correlate with our physical experience either, or the clinical symptoms we experience. And so some individuals have stage 4 endometriosis and have very few symptoms, right? And so we also need to keep that in mind when we're kind of looking at the person in front of us and deciding what the next best step is.
Yeah. So typically, would you refer people out to a surgeon, or what can be the next step that you would recommend if they are having those warning signs?
Yeah, good question. So I'm located in Vancouver, which we've got a really great endometriosis care team at our BC Women's Hospital.
Mhm.
And there's a group of gynecologists who are also endometriosis surgeons, which is super helpful. So I often refer patients to that program. Unfortunately, that wait is somewhere between 6 and 12 months.
Mm.
Sometimes if they are on a fertility journey, then that's expedited. But that's also a conversation I have is, we have this laparoscopic investigation for diagnosis, and oftentimes we do laparoscopic excision at the same time of lesions that are found. And I think there's historically been a bit of a conversation about how helpful or harmful is that for fertility, right? Especially with lesions around the ovaries and potentially causing damage to the ovaries. And so being able to have those conversations with patients as well, so they go in informed into that experience, right? They don't come out and are like, oh yeah, well, you did excision and you weren't expecting that. We thought it was just a diagnostic procedure,
Mhm.
is a big part of those conversations as well.
Yeah, that's great. Yeah, and I was reading, I shouldn't even, I can't quote exactly, but I was reading an article recently that was talking even about the degree of lesions and whether or not they will impact fertility versus, like you said, some of the outcomes that can come up with surgery. Well, there's robotic surgery and things like that that really make things more advanced and the outcomes better. It still is, it's really important to have that conversation about the pros and cons and really doing those things. I think it's so important to do those foundational pieces first and foremost, and along with whatever other treatment you're doing. So that's amazing to have that conversation and to start supporting patients, even if they are waiting for a long time to
Exactly.
get
And
some.
what I would say is that I see a good number of patients conceive along the way, right?
Mm.
While we're waiting for investigation, while we're waiting for fertility treatments, etc., right? Natural conception and ongoing pregnancy does happen, right? And so there's a lot of power in some of these foundations as well, right?
Absolutely, a lot of power. Yeah.
Yeah. Yeah.
Yeah. And then going beyond that, say someone who, maybe they've done a lot of treatment, they've done maybe even surgery and things like that, and they're still not getting pregnant. If someone is going down to, like IVF or something like that, are there any special implications or things that they need to think about as someone with endometriosis going into those treatments?
Yeah, good question. So, one of the big things from like an IVF protocol itself, right, is that oftentimes if this isn't part of the plan, we'll advocate for like a bit of a suppression before an embryo transfer, right, with something like a GnRH antagonist so that we just get this like quieting down of everything, right, so that the body's more receptive for that embryo when it gets implanted, right? So that's something that I'll often help my patients advocate for if it's not part of their transfer protocol. But when it comes to that first part and that egg retrieval, it's really the doubling down focus on that egg quality. And one of the things I'll throw in at that point would be something like melatonin, right? Which we know has great research for improving outcomes with IVF egg retrievals, but also has some really good research with improving pain outcomes in people with endometriosis. So that's a nice thing that we'll kind of throw in at that point on top of some of the foundational stuff that we've talked about previously. But what I would say is that oftentimes once embryos are created, then we can really like focus on that uterine environment, and that's where a lot of the kind of like naturopathic magic comes in, I think.
Awesome. I love that.
Yeah.
And how about, I mean, you kind of mentioned that like melatonin, bringing that in later. Are there any other things, even maybe like newer treatments or things that you're sort of like getting more excited about, whether it be for treatment of, the pain and the symptoms of endometriosis or for fertility?
Yeah. So when it comes, so for people who are not trying to conceive, and in BC, I've got prescribing rights, which is a really helpful piece when it comes to treating endometriosis, because a big part here is that like pain management matters, right? Like symptomatic control matters, especially in chronic pain conditions. Like the first thing we want to do is break that pain cycle, right?
Mhm.
Allow you to experience pain-free periods of time, right? To know that you can get to that place of symptom relief, right?
Yeah.
So I'll often kind of layer in some of those pharmaceutical options that are quite efficacious at providing that pain relief while we do all this foundational stuff at the same time. And so that often looks like something like Vizan, which is a progestin, or Lissa, which is a newer drug, which is that GnRH antagonist that we just talked about as well. And both of those really lower estrogen production, or Lissa actually pretty consistently blocks ovulation altogether,
Mhm.
and provides very significant pain relief for people with endometriosis. And so that's really helpful too, because when we're in chronic pain and fatigue, it's really hard to implement lifestyle change, right? To get consistent with those healthy habits. And
Yeah.
so by providing some of that space, and then we can implement those foundations, then the transition off of those medications on the other side is a lot more efficacious. So those are things that I like to have as options for my patients as well, if it's something that they're open to or feel like they need support with.
Yeah, amazing. And I love how you're like it oftentimes we're having a conversation about like an integrative approach. It's like, oh, all the natural things, and you're shedding light on the fact that we can use all the tools together and really keep our patient in the limelight and the focus and make sure that they're feeling their best and using whatever tools are going to be the most helpful for them. And like we don't have to ignore some of these pieces. So that's great that you have the ability to bring those in as well.
Yeah, yeah.
Mm.
And I have to say that some of the radical shifts that I've seen with that combination make me so inclined to continue to offer that and have those conversations with patients. I've recently had somebody who had chronic pain daily, was on EI, had to move back in with her parents in her
Mm.
early 30s, couldn't take care of herself, and within kind of 6 weeks was back out on her own, back working, socializing again, feeling like an early 30 something, right? And so that quality of life piece is just, yeah, we can't undermine the importance of giving back people their quality of life, right?
It's incredible. Yeah. And not everyone needs it, right? They don't
Oh,
aren't all in that, severe of a state, but to have the options and to be able to give people, the full menu, sort of speak, and really, you know, make sure that you're addressing what they have going on. I think
yeah.
that's awesome. Yeah. Well, what are some top tips that you would give someone who, that they can implement maybe now, if whether they're trying to conceive or not, maybe they are suspecting they have endometriosis, what can they do to support their body?
Yeah, good question. So I'm going to start back with the nervous system regulation. I think that's one of the most powerful things that anybody can be doing on their fertility journey. And those are simple techniques that we have access to all the time, right? deep diaphragmatic breathing, meditations, walks in nature, just that like pause through the day, as well as finding resources and clinicians who are supportive for you, right? Whether that's a clinical counselor or an EMDR therapist, right? Whatever that looks like, I think that is something that everybody should be engaging with, regardless of where we're at in the journey.
Mhm.
The other piece that I would say is that multidisciplinary care is really like first line when it comes to treating endometriosis. And so creating that care team is so essential. And for me, again, that's the kind of mental health support or nervous system regulation support. It's a pelvic floor physiotherapist.
Mhm.
Is a central part of that team, both for the kind of structural piece as well as breaking those chronic pain cycles. So that's always part of the care team. And then oftentimes, yeah, a naturopath, a nutritionist, someone to help with those lifestyle changes again that we can start to implement and that we know have those kind of significant impacts both on quality of life and that kind of movement towards getting and staying pregnant.
Yeah, I completely agree with you there. We'll add an acupuncture too, at least in
Oh
my
my gosh,
area.
yeah.
Like the endo, we kind of have like an endo, team with just like cross referral, and it's like acupuncture, pelvic floor physical therapy, the surgeon, and functional medicine or naturopathic doctor there to support their overall well-being and nutrition and all of that. Yeah,
Yeah.
amazing.
Yeah. No, acupuncture is, yeah, a huge one. I think when think of my like list of referrals, like
Mhm.
those are my top four referrals always to everybody, right?
Yeah.
And acupuncture bumps over into the nervous system support too, right? So
Yes.
that's beautiful.
Yeah. Yeah. Amazing. And any other tips that you would recommend or things maybe like something you want to clear up beyond that?
I think the one thing we haven't touched on that is really important when it comes to this like endo fertility crossover is the microbiome, both the gut and the vaginal uterine microbiome, right? We know that uterine microbiome is so important for getting and staying pregnant, right? The lactobacillus dominant bacteria is really helpful for that implantation. And we know that people with endometriosis have a different microbiome than women without, right? And so this is something that we really want to pay attention to. And there's some really cool testing that we can do to assess what the vaginal and uterine microbiome are doing, right? If there's any sort of digestive issues, that kind of IBS like symptoms, right? We're treating that as well because we know that that has significant impact when it comes to, again, both quality of life with endometriosis and optimizing those fertility outcomes, especially embryo transfers. That's the one big thing that I'd throw in with embryo transfer support is a lot of that uterine vaginal microbiome support. Mhm.
I'm so glad you bring that up because that is such an important one for really for everyone, but like you said, especially in endometriosis, because we know that there is a difference in the microbiome, which I think is still being fully understood. But and I mean with that too, where do you start with supporting the microbiome? I mean, I know like I think you and I probably both know what that usually looks like, but to someone who is like, what does that even mean? Where can they start with that?
Yeah. Sure. So we can either start just based on symptoms or we can do some testing, right? So if we're looking at gut, it's often a stool test, right, where we're assessing what's going on with that gut microbiome. If it's vaginal and uterine, there are vaginal swabs that you can even do at home that give us really cool data. And that uterine microbiome, we used to only get access to it through like an endometrial biopsy, but now there's some really cool testing too that actually uses menstrual blood to assess the uterine microbiome, which can be collected at home, which is really exciting. And so we get that information and then we see, right? Are there pathogenic bacteria that need to be eliminated, right? Do you have sufficient amounts of the commensal bacteria or the beneficial bacteria that should be there? And then we can treat. So either we have to do some kill off stuff, we've got to introduce the good stuff back in, or we have to maintain that kind of healthy uterine and gut microbiome.
Yeah, awesome. I think it's so cool. Just the stuff that's come out, and even in the past like few years with being able to test the microbiome and even the uterine microbiome, which in my not even my lifetime, but in my professional career, it was like I started out thinking, oh, there shouldn't be any bacteria or anything in the uterus. That should be just sterile. And now we've
Wow.
come so far to think, no, it has its own microbiome, and there's normal for there to be bacteria there, but we want to make sure there also isn't just pathogenic bacteria. So
Yeah,
amazing.
exactly. Crazy. That shift is truly radical, right? From going from sterile to there are bacteria and they matter a lot, right?
Hmm.
That's a huge kind of shift in medicine and perspective over the past, yeah, what, 20 years?
Yeah, absolutely. Well, Dr. Liza, this has been so helpful. It's been a pretty quick conversation, but I think we've hit so many amazing points on this topic. And I think you've given a lot of really great information for people to best support themselves and kind of investigate further to see if there's a factor for them. Where can they find you, especially for people who are located in your area?
Yeah, amazing. So the best way to connect with me is on Instagram at Dr. Liza Klassen. And so I love connecting there. Send me a DM. And then if you'd like to work with me and you're in British Columbia, I see patients both virtually and in person. And you can book with me. There's a link on that Instagram page as well for working together. So that's kind of the one-stop shop. And I do actually have a free webinar entitled Get and Stay Pregnant, and that's on my website. And I believe we'll be sharing the link for that as well in the show notes. And so if you're interested in learning a bit more about me and how I approach kind of fertility medicine, that's kind of where I would direct you.
Amazing. Thank you so much. And again, just to bring it back to that nervous system piece and that support piece, it's so easy to think that we have to do it all of ourselves and just figure it all out, but having the right support is so imperative. And so for anyone in British Columbia, go find Dr. Liza and or if wherever you're located, get the right support. I even just to add in a little comment here, just this week I have a new patient who is actually another fertility provider, and she's like, I just felt like I had to figure this out myself. And it took some time for her to realize, like, okay, I really need the support myself. And it's just to say, you could be an expert in this and still need the support because your nervous system needs that. You need to be held and supported in this type of experience. So, yeah, that's my final comment.
I wholeheartedly agree with that. Yeah.
Well,
Yeah.
thank you so much, Dr. Liza, for being here with us today and for providing such amazing information.
You're welcome. Thanks so much for having me. And I look forward to more conversations like this in our future.
Yeah, my pleasure. Take care.